Taoiseach, last year you apologised in relation to the issue of discretionary medical cards, and you apologised to the people, and you said the government had to take remedial action to make up for the unintended consequences of the savage review that was in train at the time. And then you said that the government had announced a new plan which would bring flexibilities, local input and discretion. And certainly there were improvements, and many people had their discretionary medical cards restored. But Taoiseach, I would put it to you that there are still very serious issues in relation to quite a number of children with very serious conditions and illnesses. I have a case of a 9-year-old young girl with B-cell lymphoma, a very rare cancer, and indeed this has been in the public domain. She's had surgery and intensive chemotherapy, and yet despite considerable submissions to the HSE, she has been denied a discretionary medical card. And we've pursued the issue ourselves when we heard about it. She's under a medical team in Crumlin who have also made submissions to the HSE in relation to it. The mother has had to give up work. It has caused immense strain, anxiety, and I would put it to you, Taoiseach, that parents should never be put in this position, particularly when children have such serious conditions. Last week, a family travelled from Mayo with their 18-month-old son Ryan, a Down syndrome child with a significant cardiac condition, apnea and so forth, accompanied by our Children's Health campaign. I believe you wrote to the family, to Nicola, the mother, saying that I trust the issue will be resolved to your satisfaction as soon as possible. Now, Taoiseach, this year it is intended to roll out free GP care for under 6s. It's fine. But what many people cannot comprehend is how two young people in this situation, who are in one case over 6, one 18 months, can still be denied full medical cards, despite all the talk about flexibility and applicability of local inputs, can still be denied medical cards, while perfectly healthy children under 6 will receive free GP care towards the end of the year. And I'd ask you, Taoiseach, could you first of all ensure that what you said last year will apply, that there will be common sense and flexibility applied to very serious situations? This should never have had to be raised, and I shouldn't have to raise this at this stage on leaders' questions. I'm only doing so because it's the last, if you like, opportunity I have to try and get some realism and common sense in relation to the two cases that I've mentioned. And I've been working on the young 9-year-old case for quite some time now. And yesterday the officials said that it would be another year before the discretionary card system was in place. Now, I don't think that's correct, or maybe the new flexibilities or the new medical panel or whatever. But children in these situations can't wait, Taoiseach. And I'd ask you to intervene and ask how can you justify, rolling out the under 6 and at the same time denying the very chronically ill over 6s. Thank you.
Well, I don't want to comment on the details of any particular case. In some of these cases where a card was refused on the basis of income, because the Keane report, which is commissioned by the Minister on the basis of considering whether cards could be granted on the basis of an illness, said that it was not morally, ethically or in any case justified. So the application process goes back to the element of discretion, where an application comes in and there may be a child or children or whatever to be considered by discretion, and that's been much more flexible than it used to be, Deputy. I think the figures are increased from about 52,000 discretionary cards issued in the middle of last year to over 77,000 at the end of December. So there is a far greater degree of common sense and sensitivity applied here. And there is also the question of check back with the local medical medical and health officials to see are there local issues or changes of circumstances that apply. I note your comment in respect of the first case that you mentioned there, that one of the parents has given up work, which obviously would mean a change in terms of the income circumstances of that particular family. In regard to the second case, my understanding is that, and what's important in all of these cases, are the access to facilities and treatment and issues that might arise for the children involved. And my understanding is that the second case that you mentioned has access to the long-term illness card, has access to the GP card, has access to the facilities that the child needs, and whatever the medical requirement of that child is, as I understand it, is being approved and has been approved. My understanding is that if the child needs orthopaedic shoes, that they will also be made available depending on when the child is fitted for them. Now, I don't have the details of any of the individual cases around the country, but the Minister's made it very clear here that what you do need is a degree of common sense, and that where discretion has to be considered, that it should apply. Now, if Deputy Colery has different information, then I'd certainly make that available to the Minister for Health, who's very anxious that nobody wants to have a case of where a child is sick and can't have access to medical facilities and medical treatment. And as has been pointed out, until you get to a point where you have a universal health scheme, you're always going to have people who are over whatever the limit might be for a medical card application. And then you're down to the question of discretion for circumstances that arise. So without detailing the individual circumstances of children or any individual here, I hope that the point you mentioned about a change in circumstances is checked back. I don't accept, Deputy, at all that there should be a wait of 12 months before a decision can be made about a discretionary card. Clearly, that's not true.
Thank you.
If you have, gone from 52,000 to 77,000 discretionary cards issued in the last 6 months.
Taoiseach, first of all, in relation to the latter case in terms of young Ryan, I mean, there's 50 pages of information gone into the HSE in relation to that case. The long-term illness card doesn't cover all the aids and facilities that the child requires. And by the end of the year, you're claiming you're going to roll out free GP care to 1 to 6s. There is no justification for this kind of behaviour. In terms of the first case I mentioned, Taoiseach, and you did say, Taoiseach, in relation to Ryan, that you would hope that the matter would be resolved to his satisfaction. You wrote to him in October, to the parent. And it's not resolved to their satisfaction, and 65,000 people have signed a petition in that regard. In terms of the young girl, I don't want to mention her name, even though I can if I wish, it's in the public domain. But, the submission from Dr. Angus O'Markey's consultant paediatric hematologist outlines very clearly that the diagnosis and treatment has required the parents of this child to provide a level of care which is greatly in excess of that normally required by a child of her age. The mother has written, my daughter is diagnosed with B-cell lymphoma, a very rare cancer, which has been managed by a medical team consisting of a number of consultants.
Thank you.
Medical conditions constantly evolving, changing, and so forth. And Taoiseach, what parents want in situations like this is security. And they don't need the stress and anxiety that the endless toing and froing with officialdom brings while they're dealing with a very sick child in hospital. And from our experience of this one, it seems to us that there is no acknowledgement of that or recognition of that when you have parents in such very, very difficult set of circumstances. And it's the juxtaposition, Taoiseach, of, on the one hand, very healthy children will be getting free access to GP care, but very sick children, over 6, are still being denied the medical card, which I think would give a significant degree of security and reduce the worry and stress levels, and also be of practical help, of course, in terms of the frequent visits to GPs and to medication and so on that this condition clearly requires.
Thank you.
So I'd ask you, Taoiseach, again, you didn't answer the core question in terms of how we can justify that as a society and how children like this can be left in such a situation. And can you ensure that what you promised us, Taoiseach, because you did apologise, and you promised that there would be flexibility. These cases do not illustrate any such flexibility or common sense being applied to very genuine situations.
Taoiseach. Well, nobody will disagree with your comment that parents should be stressed or put under pressure in respect of their children. And that's why one of the reasons why the government has set out the objective of bringing in universal health insurance for everybody. It's a longer term business, but in the short term, nobody wants to see parents stressed with difficulties with their children. Now, clearly, there has been a far greater degree of discretion applied here because 22,000 extra discretionary cards have been granted from mid-2014 to the end of 2014. I think the important thing here, Deputy Martin, is there an outstanding treatment or facility or product that either of these two children need? Because it's access to the treatment and the facilities that parents need to know that they're not blocked from having these things. My understanding in the second case is that everything that the child requires is being made available. Now, if Deputy O'Leary has different information, I would say in all seriousness that whatever the outstanding facilities or products that are required by these children, please make them available to the Minister for Health here. And I'd make this point, that in the analysis of the discretion, the group who were outside government buildings for a number of months, our children's health group, and I met them on many occasions, very reasonable people. They are now working with the clinical team in assessing discretion for treatment and for facilities for children. And there is the local check back on a weekly basis. So, like, if 22,000 extra have been issued on a discretionary basis, I would hope that the HSE, in applying common sense to these cases, could see that that happens. But my understanding, now, and I don't have all the details of the individual cases, because I don't obviously work in the HSE, but clearly the details that are here, is there an issue, a product or a facility or access to a treatment that either of these two children are not receiving? Because we can't have a situation where people are put under that pressure. I repeat again, the Kane report, which was commissioned on the basis of attempting to give cards on the basis of an illness, said that cannot be. So you go back to the income threshold and discretion after that. And it's in the application of the discretion that your question, which is a very valid question, has to be dealt with. So I hope that having raised it here, that the people dealing with this can tell us what is outstanding for either of the two children in terms of treatment or facility or product.
Thank you.